Today we're going to be looking at syphilis in men. Welcome to our YouTube channel, and thanks to all our new subscribers and all those who have been liking and sharing these videos that we make. Thank you so much, and thanks for keeping it here. So syphilis is a sexually transmitted infection caused by a bacterium known as Treponema pallidum. So that's the bacterium which causes syphilis, and syphilis continues to cause challenges around the whole world. Even with the advances in healthcare, awareness, and all the information we have, there are lots of people still contracting syphilis even as we speak right now, affecting both men and women. With every year, we have over 5 to 12 million people being diagnosed with syphilis. This shows you how much it is still a challenge. And syphilis is very infectious. If you go in bed with someone who has syphilis, there are high chances that you're going to catch it. So how does someone actually end up with syphilis? You could have it through sexual contact if you're having vaginal sex, anal sex, or oral sex with an infected person. Or it could also be passed from the mother to their unborn baby during birth. So those are some of the ways in which one can catch syphilis. How do we diagnose it? Okay, so before we go any further, I ask you to subscribe to our YouTube channel. You'll be notified every time we create these videos, and you'll also help someone else to see the video, because YouTube will know that, oh, this is something that is educative. So thank you so much. By doing that, you're helping us to grow. So there are many ways in which we diagnose syphilis. We have what we call serological tests like Treponema pallidum, hemagglutination assay, enzyme immunoassay, and particle agglutination assay. So these are some of the serological tests that we can do to test for syphilis. And so what are some of the signs that show up? Syphilis, first of all, goes through 4 stages. So we have the primary, secondary, latent, and tertiary stages. Each of these stages have different signs and symptoms. The primary stage lasts about 3 to 4 weeks after the infection, and you have one sore or more sores around the penis, the anus, the rectum, and sometimes in or around your lips. So that is how primary syphilis presents. These sores actually normally show where the syphilis entered your body from. So if you have them around the mouth, chances are that's where it entered from. If you have them around the anus, that's where they entered from. If you have them on your penis, most likely that's where the syphilis entered from. Now, whether you get treatment or not, these sores will be there. So if you have not been treated and the sore disappears, it doesn't mean that you have been cured. The disease is actually progressing. From primary syphilis, it will go to secondary syphilis. Secondary syphilis is going to develop about 2 months after the infection. And here you're going to see rashes on the skin, on the palms, on the soles of your feet, sometimes on the mouth or around the anus. So this will show you secondary syphilis. Other factors that, other signs and symptoms rather, that will show up in secondary syphilis, you'll see fever, swelling of lymph nodes, headaches, patchy hair loss, sore throat, weight loss, pain in the muscles, and feeling tired. So if you have this unexplainable fatigue and you have plus the above symptoms, syphilis is very likely. Other people also have plus hair loss. Now these symptoms can go away naturally even without treatment. But if left untreated, the disease may progress to either latent stage or tertiary stage. Basically, in latent stage, the disease is sleeping, and this can take long. And so you have the disease, but it's silent. So there are no symptoms here. The infection persists in the body over the extended period of time for years and years, sleeping. And that is what the latent stage actually entails. But if you progress to tertiary stage here, though not everyone who gets syphilis ends up with tertiary syphilis, but when you do, it's very serious and it's going to damage most of your very vital organs within the body. The brain, the heart, and other parts of the nervous system is what will result from tertiary syphilis. And this will involve your blood vessels, the nervous system, of course, involving the brain, and other neural pathways. That's why people end up with tingling sensations, numbness, paresthesias, and other stuff. So that's how deadly tertiary syphilis is. Patients may also have some symptoms like severe headache, muscle weaknesses, trouble with muscle movements, changes in the mental state, you're confused or not focusing, personality changes, and even memory issues. So tertiary syphilis is indeed this serious. So now, if you have syphilis, are you doomed or there are options? Actually, syphilis is one of those diseases that responds very well to treatment. An intramuscular injection of benzathine penicillin should be able to help you get rid of this infection. So if you're out there and you have this disease, don't die in silence. There is hope. Don't forget to tune into our YouTube channel for more discussions on sexual and reproductive health, mental health, and general well-being. You don't want to miss this, so subscribe, share the video with someone else, such that they can also get this information. We want to share this information with everyone around there, out there. So thank you so much for being here, and we shall catch you next time.